There are many factors which influence or stimulate tissue repair. The cytokines, for example, stimulate fibroblasts to proliferate and also to increase their collagen synthesis. This mechanism stimulates or causes repair of tissues. If there are damaged blood vessels, coagulation cascade is performed, which repairs damaged blood vessels. Chemotaxis also promotes tissue repair. Now, going back into the inflammatory mediators, remember we had two types, the plasma-derived and the cell-derived. The cell-derived are these cytokines, for example, and also histamine, for example. These are cell-derived because they come from cells. They are made from cells. Okay, so anyway, all these inflammatory mediators promote the recruitment of immune cells, such as macrophages and neutrophils, from the blood vessel into the tissue. These neutrophils and macrophages express special receptors for PAMP, as I mentioned. So now, for example, this neutrophil binds onto these pathogens with its receptor and can engulf it. So how about the complement proteins, the plasma inflammatory mediator? What do they do? Well, if a bacteria or the pathogen is present, the complement protein with antibodies can cause few things to happen. It can cause opsonization, or it can essentially create a hole within the pathogen, causing it to lyse. So let's talk about opsonization first. Opsonization of pathogens by complement proteins and antibodies essentially coats the pathogen. What this allows for phagocytes, such as neutrophils and macrophages, to detect these pathogens more easily, to destroy it. Now, lysis of pathogen is essentially when a hole is created on the pathogen, the bacteria, causing it to burst. Complement proteins such as C3a and C5a are very important inflammatory mediators as well, as they promote inflammation. They work as a chemoattractant to attract more immune cells, and they also increase vascular permeability, allowing more recruitment of immune cells. These complement proteins, the C3a and C5a, because it's a chemoattractant, it also stimulates the repair of tissues as well. So as you can see, the complement proteins are important in the innate immune response, in the inflammatory response. Let's look at some other inflammatory mediators. But now, instead of looking at the plasma, let's look at the cell-derived inflammatory mediators. Remember, they were cytokines and they were histamine. Other inflammatory mediators coming from the cells are the arachidonic acid metabolites. So for example, endothelial cells, mast cells, as well as other types of immune cells, particularly the granulocytes, can secrete prostaglandins, which is an arachidonic acid metabolite. Prostaglandins induce fever and also cause pain. Mast cells, again, as well as other types of cells, such as basophils, can secrete also leukotrienes, and these are also arachidonic acid metabolites. They work as a chemoattractant and also increase vascular permeability, and therefore they promote inflammation. So these arachidonic metabolites, the leukotrienes and prostaglandins, are inflammatory mediators, cell-derived inflammatory mediators. So essentially, from this whole map, all these inflammatory mediators and everything, the histamine, cytokines, complement proteins, etc., they cause the characteristics of inflammation. And there are 4 Greek words, as well as just an English word, that denotes the characteristics of inflammation. The first two are rubor and calor, which denotes redness and heat. And this is due to the dilating blood vessels. Then we have 2 more, which is swelling. And this is due to the leakage of plasma fluid and also the proteins from the blood vessels into the tissue. The 4th Greek word that denotes inflammation is dolor, which is also Latin, I think, and that denotes pain. And this is due to the sensory nerve fibers firing, and also there can be mechanical damage to the nerves. And also prostaglandins, remember, causes pain. Now, there can also be a fifth characteristic of inflammation, which is loss of function, and this is usually when it's chronic inflammation. Now, as we know, the immune cells play a critical role in the inflammatory response. What just happened with all these inflammatory mediators are part of the innate immune system. But if a pathogen causes an infection in the body, the adaptive immune system has to be initiated. These are the cells within the lymph nodes. So what can happen is antigen-presenting cells, such as dendritic cells or macrophages, can engulf the bacteria or the pathogen. This will activate it. This will activate the antigen-presenting cell, which will then allow them to travel to the lymph node via the lymph vessel and to activate the adaptive immune response, to activate the cells within the lymph node, the naive B and T cells. So here, this dendritic cell, upon activation, travels to the lymph node with the antigen of the pathogen, essentially with the pathogen. And with the pathogen, it will activate the naive B cell and T cell. The naive B cell will become a plasma cell, which can secrete antibodies. And the naive T cell will become either a T helper cell or a T killer cell. These cells are the lymphocytes, and they are part of the adaptive immune response. They are very specific and will attack the pathogens that has invaded the body specifically. So for example, we won't really talk about them, but the plasma cells will secrete antibodies such as IgM, IgG, and IgD. And these antibodies will stimulate the inflammatory response and try to remove the pathogens and bring the body back to normal state. If you want to learn more about the adaptive immune response and the innate immune response specifically, I've got a video on that, and I'll provide the link at the end of this video. So that is it for inflammation. I hope you understood it. As you can see, there are many factors playing a role in the inflammatory process, in the inflammatory response, particularly the inflammatory mediators. Thank you for watching.